This is Sarah Washington completing the module for psychodynamic theory. My patient for this theory is 15-year-old Laura, who was admitted to Friends Hospital for attempted suicide on Motrin, depression, and anxiety. The patient states that she got into a physical fight with her mother the morning before school. She states that when her mother woke her up, she had a bad migraine and also was agitated because of the migraine. So when she got up to go into the bathroom and going from her room, she was slamming the door. Her mother became agitated by her slamming the door and began to yell at her and reached to hit her. The patient states that it was then when her mother reached to hit her that she hit her mother back. As a result of the fight, the patient did sustain a swollen lip as she has braces, and she said when her mother went to hit her in the mouth, her mouth got hooked on the braces, which caused the swelling. The patient states that while her mother and her were fighting, someone called the police. She's not sure who called the police. She says she lives in a row house and it could have been one of her neighbors. The police arrived with the ambulance, and the patient states that once they were in her home, she began to suffer from a panic attack. The patient states that once she arrived at the hospital, she began to explain what happened between her and her mother. The patient states that she suffered from a migraine since the night before, and over the course of a 24-hour period, she had ingested 4 Motrin pills. Laura states that the staff at the hospital increased the amount she ingested from 8 to then 12 Motrin pills, and began to say that she attempted to overdose and that she was depressed. Laura states at that point she became agitated with the staff and got into several arguments that night. The patient states that she was forced to sign herself into Friends Hospital by the hospital staff because they threatened to 302 her and forced her to go to the hospital against her will. In meeting with Laura, I completed her psychosocial assessment. She states that she has a diagnosis of oppositional defiant disorder. She states that she has been hospitalized twice before and has had outpatient treatment. She states that she is currently on medication, however, her mother fails to give it to her on a daily basis. She reports a history of fighting her classmates, which began during the 3rd grade and lasts up until 7th grade. She said that she would fight on a regular basis, she says even a daily basis, and was suspended often. She states that she is very argumentative with her teachers and other authority figures, including her mother. The patient does not report a history of violence from her mother. However, she did report one time that she was staying with her grandmother. Her brother had spilled some juice on the floor, and her grandmother began to yell at her brother. The patient states that when she asked her grandmother why she was yelling at her brother like that, her grandmother began to punch her in the eye several times until she began to bleed from her eyes. The patient stated at that time she was 10 years old. At that point, there was DHS involvement. The investigation, there was a DHS investigation. However, the patient states that she and her brother were able to return home because the incident did not occur in their home. The patient adamantly denies that she has an issue with depression, suicidal ideation. She declines suicidal thoughts, and she also states that she is not depressed. She says that she is here at Friends Hospital for no other reason other than the hospital staff at St. Christopher's Hospital forced her to come there because they tried to say she attempted suicide. She adamantly denies that she had tried to attempt suicide, and she says that she's ready to go home. The patient identified the relationship with her mother as just being okay. The patient does not indicate whether or not her father is involved with her life. Psychodynamic theory would indicate that Laura has a defective superego, an ego which may be due to a lack of inconsistent parental discipline. I'm sorry. Laura has a defective superego or ego, which may be due to lack of or inconsistent parental discipline, lack of affection and warmth during the developmental stages, or parental deprivation. Psychodynamic theory looks to go back into childhood to determine the root of current issues, the root and the stimulus. The purpose of the superego is to act as a moral compass within our conscious. Psychodynamic theory indicates that there is an internal conflict between the ego and superego, which results in Laura's conduct disorder. Laura will be well once she establishes peace within her conscious that will prevent the anxiety leading to her deviant behavior. The interventions used to address the problem in psychodynamic theory would be ego psychology, because it suggests that the problem that present themselves later in development stem from beginning to ego psychology suggests that problem that presents itself later in development stem from the beginning attachments with our caregivers. The defective superego is suggested to originate from a defect in parenting. While it is unclear to what extent there was defective parenting in Laura's life, therefore, the following interventions are suggested: individual and family therapy, in addition to encouraging medicinal adherence. Laura has indicated that in the past, individual therapy has helped her, so it would only be safe to say that going forward, individual therapy would be helpful for her, and also include family therapy with her mother to try to resolve any underlying issues that may be there. The two interventions or approaches would be suggested by this model would be ego psychology along with object relations theory. They both can assist in repairing the poor relations that Laura has in her life, so that she can begin to develop positive behaviors and positive ways or habits to deal with any negative stimuli. In the psychodynamic model, change will occur once the client utilizes therapy sessions to review her childhood to determine where the problem began and to determine the source. Laura will begin to develop coping mechanisms to help with deficiencies of her childhood, and her ego will begin to properly balance her id and superego. The problem source may not even be her mother, so it would be helpful to determine where the source of Laura's anxiety stems from, so that way she can begin to start the healing process and move forward with her life, and to let go of some of the anger that she may be holding on to, especially the defense mechanism that she tends to have, which is why she may